Hi, I'm Dr. Kelly Starrett with the Ready State, and I'm asked often, should I use my H-wave before surgery or I should wait till start to use it after the surgery? And we are big fans of integrating this amazing technology into my pre-surgical process for a few reasons. Number one, the more comfortable I can get with pad placement, understanding how to use high frequency and low frequency, how I can adjust positions of the pads to have different outcomes of muscle recruitment, all of that makes it effortless to engage with brand new technology when I'm in a little bit more of a threatened post-surgical state. So absolutely, just get comfortable with it, start using it, start to feel how simple it is to integrate this extraordinary technology into sort of your pre-game process, because it's gonna be a lot easier when you get home from the hospital. Number two, we're trying to keep as much muscle mass on the athlete as on the patient as we possibly can. And an inhibited musculature system, a system that's swollen and congested, doesn't move, and that inhibition that begins when I have a big swollen joint or a big swollen tissue system often leads to a real quick disuse atrophy. So the earlier I can get that muscle recruited, that neuromuscular recruitment drives a lot of protective mechanisms that keeps me from losing this mass. So I'm worried about having a quad smaller than the other quad, or keeping my muscle the same on both sides, or just maintaining function. Keeping the leg plugged into the system makes a big difference. Three is that a surgeon is going to want to work on a tissue system that isn't highly inflamed and very swollen. Oftentimes we hear that someone says, hey, I went and saw my surgeon, but she wants to see me in 2 or 3 weeks once the swelling has come down. And in those situations, I'm like, good, give me 24 hours. We can get ahead of this swelling. Which means that if we think about surgery as sort of controlled chaos, controlled trauma, the sort of more we can control some of those factors going into that, because I have a system that's comfortable with movement, a system that's got under good pain control, and a system that isn't congested, that means that the surgeon is gonna have a lot easier job doing her thing. And we're not automatically loading up more trauma on a system that's already traumatized. So whenever we can get that tissue moving again, remember, H-wave is really just a movement device. It's a lot of movement without motion of the actual limb. I can keep that brain plugged into the tissue system, I can manage that congestion, and I can begin to think about, hey, I can actually get off some of this pain medication that I'm using to manage this post-trauma issue before going to surgery. Those are all win-win-win-win. So the bottom line, should you get your H-wave before surgery? Yes, as early as you can, as often as you can, because it's only gonna set you up for success on the other side. Hi, I'm Dr. Kelly Starrett from the Ready State. One of the reasons we love to use H-wave in surgical situations is it allows us to skip over this whole neuromuscular inhibition. If you've ever heard someone have knee surgery, for example, they'll often talk about the fact that they have a real hard time recruiting their quadriceps. In fact, a lot of the post-surgical sort of response from physical therapists and rehab after knee surgery is just keeping the knee sort of re-plugged into the brain. How do we reestablish this neuromuscular control? We have a whole bunch of exercises, active straight leg raise and quad pumps, and we're just trying to keep that knee musculature from being inhibited from the trauma around the knee. Well, guess what? Oftentimes when we use H-wave, we don't have this problem. We just skip right over. In fact, the faster we can get the H-wave on the affected limb, the earlier we can get this sort of motor recruitment, neuromuscular connection bridge reestablished, which is amazing. One of the things that happens is just by getting this non-fatiguing muscle contraction right away is that we reestablish this connection to the brain. We're getting 2 pumps a minute, and the brain says, oh, I know how to recruit that. Additionally, even when people are numb, we can still be actually practicing firing the quadriceps when the move is pumping or when the leg is pumping. So what ends up happening is that I'm getting 2 pumps a second, that's 2 hertz, and I can do a quad set with each one of those, so I can kind of use it to jumpstart the system. The H-wave is actually FDA cleared for neuromuscular rehabilitation, but we often find that we don't have to even use it for those things if we can have early enough intervention where we can keep that connection alive. And literally, one of the things that happens is that my athletes come out of surgery and they're like, I didn't even have a knee problem. I didn't have extensor lag. I was able to maintain my quads. And that puts things on like disuse atrophy off the table, which means that disuse atrophy means if I don't use the muscle and I'm disconnected for a week or so, I oftentimes can start to eject and lose some of the structural proteins of that leg, which means that it's harder to reestablish control, it's harder to keep the mass on, harder to keep that strength. We want to nourish and keep that engaged as much as we can, and we do that through early activation. And that early activation means I just put on the pads and start pumping away. It's very, very easy. It's low sort of invasiveness. And even if we're seeing a leg that's highly bandaged, we just move the pads around until we get a solid contraction in some aspect of that leg. And oftentimes we're able to find enough real estate where I can still get a massive contraction without having to kind of disrupt the need to keep the area sterile and clean. The bottom line is, we think that an H-wave is a fast track to expedited healing. Because remember, you're either going to heal at the rate of a human being or heal slower than that. There's no such thing as a fast healer. But if you use an H-wave, your friends are going to think you are a Wolverine.